10 warning signs of colon cancer you can't ignore. Hello, guardians of health. Ready to transform your health today? Did you know that small changes in how your body functions can indicate something much bigger? Imagine your intestines as an engine, working tirelessly to keep your body balanced. However, when something is wrong, they may send out silent signals, almost like a cry for help. That's exactly what we'll discuss today. The 10 most common signs that could indicate colon cancer. Colon cancer is one of the leading causes of cancer-related deaths worldwide. Studies show that early detection significantly increases the chances of successful treatment. But how do you recognize these signs and act in time? In this content, you'll learn to identify the most important symptoms and understand how they relate to your intestinal health. Get ready to discover valuable information that can be applied immediately to protect your health and your loved ones. Are you ready to dive into these details? Let's begin with the most common signs and what they may mean for your body. Persistent changes in bowel habits. If you've noticed changes in your bowel habits, such as frequent diarrhea or constipation, pay close attention. These changes might be temporary, caused by factors like diet or stress. However, if they become persistent or have no apparent cause, they may be an early warning sign of colon cancer. This happens because tumors in the intestine can interfere with the normal flow of stool. As a result, you might experience difficulties passing stool or notice unusual bowel movements. Studies from the American Cancer Society reveal that changes in bowel habits are often associated with early stages of the disease. Unfortunately, this symptom is frequently overlooked, attributed to common causes like diet or temporary infections. If you notice this signal, a helpful practice is to track the frequency and pattern of your bowel movements. Keeping a food journal and consulting a doctor for specific tests, like a colonoscopy, can help identify the problem's source and prevent major complications. Presence of blood in the stool. One of the most concerning signs is the presence of blood in the stool. It can appear in two forms: visible blood, seen with the naked eye, or hidden blood, detectable only through lab tests. Blood might indicate polyps, which are abnormal growths in the intestinal wall, or a tumor causing bleeding. According to the National Cancer Institute, blood in the stool is one of the most commonly reported symptoms among patients diagnosed with colon cancer. This happens because, as the tumor grows, it can damage blood vessels in the intestine, leading to small hemorrhages. While not all bleeding points to cancer, ignoring this symptom can delay a critical diagnosis. One way to monitor is by observing the color of the blood. Bright red blood often indicates problems in the rectum or lower intestine. Darker blood, almost black, might suggest that the bleeding occurs higher up, like in the ascending colon. If you notice this symptom, seek a specialist for immediate testing. Constant abdominal pain. Do you experience frequent abdominal pain or cramps that seem to have no end? This discomfort could indicate something more serious than simple indigestion. In the case of colon cancer, abdominal pain is a common symptom caused by the presence of tumors in the intestine. These tumors can partially or completely block the flow of stool. They may also cause inflammation in the intestinal wall or press against other internal structures, leading to pain in the lower abdomen. The intensity of the pain can vary and may not follow a clear pattern. This often causes people to ignore it or attribute it to minor issues like gas or constipation. However, if the pain persists or worsens over time, it's crucial to pay attention. Research from the National Cancer Institute indicates that abdominal pain related to colon cancer often starts subtly but intensifies as the tumor grows. To address this symptom, start by noting when and how it occurs. Document its intensity, frequency, and any other relevant details that could help a doctor assess your condition. A healthcare professional may recommend tests such as a CT scan or colonoscopy to identify the exact cause. Remember, recognizing and acting quickly can make a significant difference to your health. Unexplained weight loss. Losing weight effortlessly might sound like a dream to some, but when it happens without explanation, it's a cause for concern. Unintentional weight loss is one of the most common signs of colon cancer, especially in its intermediate and advanced stages. Intestinal tumors can interfere with digestion and nutrient absorption. Additionally, they may release substances that speed up metabolism, leading to rapid and unintended weight loss. The American Cancer Society states that approximately 40% of patients diagnosed with colorectal cancer reported unexplained weight loss before their diagnosis. This symptom occurs due to the tumor's impact on the body, including increased systemic inflammation. It often coincides with other symptoms like extreme fatigue and loss of appetite, making the condition even more alarming. If you've noticed significant weight changes without altering your diet or exercise routine, consult a doctor immediately. A detailed evaluation may include blood tests, endoscopy, or colonoscopy to pinpoint potential causes. For those looking to take a proactive approach to health, check the link pinned in the comments. There, you'll find a complete resource to help transform your health and ensure lasting well-being. Persistent fatigue, feeling exhausted even after a good night's sleep, could indicate more than just accumulated tiredness. Persistent fatigue is another symptom that may be linked to colon cancer, particularly when anemia caused by intestinal bleeding is present. When the body loses blood continuously, it struggles to transport enough oxygen to tissues, leading to extreme and ongoing fatigue. Studies published in the Journal of Clinical Oncology highlight that chronic fatigue is a common symptom among colon cancer patients, especially in the early stages. It is often mistaken for stress or other conditions, delaying a timely diagnosis. If this fatigue is accompanied by other symptoms, such as weight loss or abdominal pain, consult a doctor for a comprehensive evaluation. Identifying the underlying cause of fatigue can be crucial for ensuring your health and quality of life. Signs of intestinal obstruction. One of the more severe symptoms of colon cancer is intestinal obstruction. Tumors in the intestine can grow large enough to partially or completely block stool flow. This leads to symptoms like abdominal bloating, nausea, vomiting, and difficulty or inability to pass stool. Experts from the National Institute of Health point out that intestinal obstruction is often a sign of advanced disease. This condition can cause extreme pain and severe complications, such as infections or intestinal perforations. If you experience a combination of these symptoms, seek emergency medical attention. Treatment may involve procedures like surgery or stent therapy to relieve the obstruction. Paying attention to these signs can prevent more serious complications. Unexplained anemia. Did you know that anemia can be one of the earliest signs of colon cancer? While many associate anemia with a diet lacking in iron, it can also indicate something more serious. Colon cancer often causes small intestinal bleeds, which, although invisible to the naked eye, can lead to ongoing blood loss. Over time, this blood loss affects hemoglobin levels, causing persistent fatigue and weakness. According to the American Gastroenterological Association, unexplained anemia, especially in adults over 50, is a strong indicator of potential issues in the digestive tract. This is particularly true for postmenopausal women and men, where anemia is less likely due to nutritional deficiencies. Accompanying symptoms can include shortness of breath, dizziness, and pale skin, making a medical investigation even more urgent. If you've been diagnosed with anemia without a clear cause, discuss further testing with your doctor. Procedures like a colonoscopy or stool tests for hidden blood can help identify the root issue. Changes in stool diameter. Have you noticed your stools becoming thinner than usual? This often overlooked detail can be a significant warning sign. Changes in stool shape may indicate a partial blockage in the intestine, often caused by tumor growth in the colon. As the tumor obstructs the intestinal canal, it reduces the available space for stool to pass, resulting in thinner or irregularly shaped stools. Studies published in the Gastroenterology Journal report that changes in stool diameter are frequently noted by colorectal cancer patients. However, this symptom is often mistaken for conditions like hemorrhoids or irritable bowel syndrome, delaying the diagnosis of more serious diseases. Any persistent change in stool shape should be evaluated by a healthcare professional. Observing such signs and seeking medical advice is crucial for early detection of potential issues. If you want to learn more about maintaining a healthy gut and preventing serious illnesses, check the link pinned in the comments. Feeling of incomplete evacuation. Do you often feel like your bowels aren't fully emptied even after going to the bathroom? This persistent sensation can be a warning sign of colon cancer. Tumors in the intestine can cause partial obstructions, making bowel movements incomplete and leaving you with the feeling that something is still stuck. According to the World Health Organization, this symptom is commonly associated with colorectal cancer. Unfortunately, it is often mistaken for chronic constipation or irritable bowel syndrome. Without treatment, the tumor may continue to grow and worsen the symptoms over time. If you frequently experience this sensation, consult a doctor and describe your symptoms in detail. Diagnostic tools like imaging scans and a thorough clinical evaluation can help identify the root cause of the discomfort. Addressing this symptom early can prevent further complications and ensure prompt treatment if needed. Family history and associated risks. If you have a family history of colon cancer or other intestinal diseases, you should be extra vigilant. Genetics plays a significant role in determining the risk of developing this condition. This is particularly true if immediate family members, like parents or siblings, have been diagnosed with colorectal cancer. Research from the American Cancer Society shows that individuals with a family history are 2 to 3 times more likely to develop colon cancer compared to those without a genetic link. Inherited genetic mutations, such as Lynch syndrome or familial adenomatous polyposis, significantly increase the risk of polyps and tumors forming in the colon. For those in high-risk groups, prevention is key. Undergoing screenings like colonoscopies starting at age 40, or even earlier, depending on your family's medical history, can be life-saving. Discuss personalized screening plans with your doctor to stay proactive about your intestinal health. Early detection dramatically increases the chances of successful treatment and long-term health. As we've learned, the warning signs of colon cancer can often be silent, but recognizing them early makes a critical difference. Changes in bowel habits, blood in the stool, persistent pain, unexplained weight loss, and even genetic factors shouldn't be ignored. Paying close attention to your body is the first step toward protecting your health and ensuring early diagnosis, which significantly boosts survival rates. If you recognize any of these signs, seek medical advice promptly. Incorporating healthy habits and regular screenings into your routine can help prevent this condition and many others. Now it's your turn. Which of these warning signs caught your attention the most? Share your thoughts in the comments to help others understand the importance of these symptoms. Don't forget to like, share this content, and subscribe to the channel for more health and wellness tips. Until next time, guardians of health. Stay strong, stay healthy, and keep thriving.